Hello, I'm Andrea Lord and I'm a continence advisor. I work with people who have bladder or bowel control problems and with the people who care for them. A continence assessment is the process of finding out the cause of the incontinence, the treatment and the management options.
Who performs these assessments?
Every District Health Board or DHB in New Zealand has a team of health professionals, either nurses or physios, who've received specialist training in continence. They are called continence advisors. You can obtain a referral to a continence advisor by contacting your local advisor, contacting the Continence helpline on 0800 650 659 or arrange a referral through your GP. The continence advisor can either visit you at home or you can see them at their clinic or continence advisory service.
What happens during the assessment?
The continence advisor will help to identify the factors influencing your continence and work out a treatment plan. They'll then work with you to identify the best way to manage your incontinence, which may mean identifying continence products that suit your need, such as a pad. If you or the person you're caring for is experiencing incontinence and the treatment plan has not worked, you may be entitled to continence products from your local DHB or ACC. If you're not eligible for products or require extra product, the continence advisor will tell you where you can obtain extra product, often at a reduced cost.
Where can I obtain continence products?
Continence products can be obtained directly from the supplier, your supermarket, some DHB hospital supply departments or your chemist. Additional funding may be available through work and income. If you would like further help about this support, please contact Carers New Zealand for a free information pack on 0800 777 797. Details of the Continence Advisory Service nearest you can be found on the New Zealand Continence Association website www.continence.org.nz or phone the National Continence Helpline on 0800 650 659.
What can I do before I see the continence advisor?
There are several things you can do before your continence appointment which will help identify the cause and the extent of the problem. Firstly, you can complete a bladder diary or bladder chart over a 3-day period or at least a 24-hour period. A bladder diary shows when the urine was passed, the volume passed and any other comments such as the times you felt an urgent need to get to the toilet. You can record the volume of urine passed using a plastic container such as this one. Pre-measure it on the outside in 50 ml measurements and then, if possible, pass urine directly into the container. Observe how much urine has been passed, record the measurement, then dispose of the urine into the toilet. If the person you are caring for is using pads, well then count the number of pads they have used over a 24-hour period and record this. It is a good idea to also complete a bowel diary for at least 7 days, recording the time and the type of bowel motion. Use this chart to help you describe the bowel motion type. The graphics are really helpful.
What sort of questions will the continence advisor ask?
The continence advisor will ask about your past medical history, your current health status, your medications, including those from your GP, your chemist, your health food shop or your supermarket. We'll ask about your diet, your bowel habit, your fluid intake, and when the accidents tend to occur.
Will the advisor need to do a physical examination?
The advisor may perform a physical examination of your tummy or abdomen. If acceptable, they may check your front passage or back passage. They may also arrange a urine test, a blood test, or ultrasound, as well as identify any other tests that may be useful.
What sort of treatment can I expect to be suggested?
Treatment will depend on the type and cause of incontinence. The advisors will work with the GP to treat such problems as a urinary tract infection, constipation or diarrhea. They will also work with the GP to review the medications, the timing, the dosage, or identify any new medications that may be helpful. The advisor might also suggest alterations to your fluid or fibre intake, set up a bladder or bowel retraining program, teach pelvic floor muscle exercises, plan a toileting program, suggest aids and appliances such as pads and commodes, or arrange a referral to a specialist for further investigations or surgery. If you're struggling with incontinence, it's easy to think that nothing can be done to solve your problem. However, after a continence assessment, the simple advice and suggestions can really make a big difference. If you have any questions that we haven't answered, you can phone the Continence Helpline on 0800 650 659. The Continence Association will be able to give you advice and support and refer you to specialist assessment if required. Thanks for joining us at Caring at Home.